Morning, Nora. Morning, everybody. Welcome to the Mental Health Action Partnership. We're going to give another couple of minutes for everybody to get in the room. But while we wait, I am going to ask you if you would be kind enough to rename your child with your place and your organization. So I kind of set an example here. I'm Cedar Deal from NAMI, Wisconsin. I'm in Madison. My pronouns are she, her. You know, but just as if you can include your organization, if applicable, and your place, that would be really helpful. So you hover over the three little dots in the top right hand corner of your tile, and if you click on them, one of the options is rename. It helps us place each other as we're talking.
I'm not really sure how you go about seeing that person's full information.
Well, when you're in the breakout rooms,
It'll,
there will be fewer people, and so you'll have a bigger tile. That's
okay.
kind of when it gets important. Welcome, everyone. We're just taking a moment to rename your tile with your place and your organization and anything else you feel led to share, like pronouns or land acknowledgement, whatever. Kathy Markland, I think I'm going to give it one more minute just to get folks in the room. Okay, Kathy Markland, go ahead. Let's get started.
All right. Thanks so much, Sita. Good morning, everyone. And welcome to the Mental Health Action Partnership Summit. I'm Kathy Markland, Executive Director of the Wisconsin Association of Family and Children's Agencies, or WAFCA. I serve on the MHAP core group here. Thank you for joining us today. So, by way of an icebreaker, here's what I came up with today. Please put in the chat. I have been stress eating, so don't put that in the chat. But maybe that's not all of your responses to stress. But the question is salty or sweet. And so just drop in salty or sweet. Or if you're somebody who exercises or does something else that's like healthy response, please feel free to drop that in as well. Although the rest of us might take it, just be a little frustrated by that. But if it's true, please own it. Maybe I'll choose to be inspired by that. Boot camp. That is inspiring. Exercise. Good. I like to see it. Yes. Yes. Okay. Is anybody keeping tabs? Where are we at? I feel like I'm just watching things click across. I don't have my chat bar open, but it looks like a lot of salty. Maybe a lot of salty. So salty feels like a good word right now. So yeah, thanks everybody for participating in that. We will walk through the agenda shortly, but before we jump in, just like to say a few words about how we hope you will participate in today's meeting. This is a virtual meeting, but MHAP is about action. We hope you will actively weigh in from your perspective, either aloud or in the chat, because we would like you to think about how our priorities will affect you and your organization and what you can do to help advance these priorities. So really, this will be a very interactive time together this morning. And again, just so grateful for the turnout. As a reminder, here at the Mental Health Action Partnership, we have some rules of engagement that help us work together respectfully. So really, before speaking, we just ask you to consider, is it true? Is it kind? And will it move us forward? And then in terms of principles for engagement, and I will just share this with you and read these out loud. We will seek shared understanding. We will share information and perspectives. Differences of opinion are an expected part of MHAP work, and there are opportunities to learn. We agree that from where we sit, we are each doing what we think is best and fair. When advocating for system change, consider why something exists and what is needed for improvement. And when we disagree, explore further. As we seek shared understanding, we are confident that solutions will emerge. I have found that to be very true in my time with our MHAP colleagues here, and for all of you that have been gathering through our various number of events over the past coming up on 2 years, it feels like. Now I'll just walk a little bit through the agenda. So thank you all for joining me and sort of reflecting on how we gather together and really inviting you in to the conversation. So the purpose of the meeting today is to plan how to educate state legislators in local districts about MHAP priorities. In local meetings, you get more time and better interaction with elected officials than in the Capitol in Madison when they are pulled in many directions. And that is very true. Really, we're going to be focusing today on where we would have opportunities to really meet in district with legislators. Sita is going to start by briefly reviewing the MHAP legislative proposals that we've been working on for the past year. We know many of you have been immersed and part of those conversations, and we know some of you may be coming in for the first time. So we want to just make sure we're going through with a kind of high level overview. Then Mary Kay is going to give us a few pointers for planning local in-district communications with legislators, sort of the how of the communications. We'll go into breakout rooms by Senate district. And those who only have 1 or 2 people from a district will join larger groups to learn about the process of organizing an in-district meeting. And our hope is that you will organize a delegation in your community. We'll come back together at the end to discuss questions and ideas that came up in the breakouts, and then we'll review next steps and supporting materials that we've prepared. We will have a few announcements and then adjourn by 11. So now I am going to turn it back to Sita to briefly review the priorities we've decided on over the past year together.
Thanks so much, Kathy. I think my sound is on. So we have been working since January.
Sita, you're muted.
Am I muted?
I'm here. We can hear you.
Oh, okay. All right, good. So Mary Kay, can you advance the slide, please? So just as a reminder, I'm going to briefly review the 10 proposals from our work groups that require action from the legislature. There are a couple that don't require action from the legislature, but these we need, either it would be something like a budget ask, or it would be legislation, or there may be regulation that's needed, and they may need to have permission from the legislature in order to have that happen. So each of these proposals is covered briefly on the document that we called MHAP 2025 Proposals for Legislative Action. And this is a boiled down version of the talking points document that we gave you all in December. So you've received these, hopefully, with the notice of this meeting. And I think Julia may be able to put a link in the chat so you could pull them up now if you don't have them handy on your email. But you could just read through them as I talk about them. So, and I also wanted to let you know that the title of each section, or the heading of each section of this document, links to the issue paper that was created in the work group. So there's a full issue paper behind each of these little paragraphs. So I'm going to first start talking about the Medicaid work group, but before we launch into the specific proposals, I want to acknowledge that Congress is considering significant cuts to Medicaid right now. And we hope that many of you are tuning into state and national efforts to protect Medicaid. We recommend that as you share information with your legislators regarding mental health priorities for Medicaid, that you also emphasize how the current Medicaid program is a critical foundation for our mental health infrastructure in the state of Wisconsin and in every state. mental health is the largest payer. I mean, Medicaid is the largest payer of mental health services in the country. And then in Wisconsin, Medicaid is a key source of funding for a whole range of services for individuals with mental health conditions, including serious mental illness, substance use disorders. So this is from school-based services to recovery services to crisis services. Medicaid is a fundamental building block of our systems of care for children and adults in need of mental health treatment and supportive services. Those supports enable people to learn and to work and to grow in healthier families and communities. So any federal cuts to Medicaid threaten the very fabric of mental health services across the state. That said, when you talk with legislators, they're going to try to give you an excuse and say there's a lot happening in Congress, we have to wait. And I think we have to keep our eyes on the prize, and we have to say, yes, and these are things that need to move forward. We really don't know what's going to happen at the federal level, and we need to lay the groundwork at the state level. So the Medicaid work group is putting forward 3 proposals: psychiatric residential treatment facilities for youth, better Medicaid coverage of dialectical behavior therapy, and better support for clubhouse programs. So let's have the next slide. A PRTF, or Psychiatric Residential Treatment Facility, is a non-hospital facility offering intensive inpatient services to children and youth under the age of 21, and it's reimbursable by Medicaid. Because PRTFs are not currently available in Wisconsin, we're sending kids out of state for this level of care. And so we're asking for legislation and budget motions authorizing DHS, Department of Health Services, to establish PRTFs in Wisconsin. Next. Dialectical behavior therapy is an evidence-based practice that's been shown effective for people with intensive needs who are at risk of suicide. Comprehensive DBT has 5 components, some of which are not currently covered by Medicaid in Wisconsin. And so we're asking the state for a Medicaid benefit that covers the whole cost, adequately covers the whole cost of all 5 components, making it possible for providers to give this life-saving treatment as designed and achieve the outcomes that have been shown by research. Clubhouse programs are community-based mental health programs that empower people with mental illness to take control of their recovery and thrive through access to employment, socialization, education, skill development, housing, and improved wellness. So we're asking for, we have 3 asks actually, for state matching grants to help clubhouses get certified, get opened and certified, as well as improved Medicaid reporting procedures, and then a benefit that accurately accounts for best practice clubhouse programming, which happens as a community. And right now, the Medicaid, the way we kind of count 15-minute hours for Medicaid, really doesn't match how the clubhouse works. So now let's talk about the proposals from the workforce work group. Next slide. Workforce work group has 4 proposals: state loan assistance programs, qualified treatment trainees, community support programs, and peer support services. Next slide. Healthcare provider loan assistance program and the rural physician loan assistance program are state programs that offer grants, state money to emerging health professionals who agree to work for 3 years in an underserved area with an eligible underserved community. So our requests are to expand the types of providers who are eligible for these grants. So to expand the types of behavioral health professionals who are eligible to match the federal programs. A broader array of providers are eligible for federal programs than are eligible for the state programs that we wanted to match. And then also to increase maximum award amounts and to increase the overall program funding and increase the program administration funding for the Wisconsin Office of Rural Mental Health. Because as everybody knows, we have a dire workforce shortage, and this helps get people into the field and working in the very communities where we need them most. Next slide. The Qualified Treatment Trainee Program is a grants program that supports agencies that hire and supervise master's level postgraduate trainees, or QTTs, in social work, counseling, marriage and family therapy to complete their 3,000 supervised hours for advanced clinical licensure. And from 2022 to 2024, we had a lot of COVID relief money in Wisconsin, and $9 million of that COVID relief money was allocated to increase the QTT program. So that allowed for 250 grants. So that's 250 individual providers to be supported through this program, or emerging providers to be supported through this program. And then with the expiration of that funding, QTT was back down to the 750,000, which only allowed them to provide 13 grants. So think of that, 250 back down to 13. And we really have a dire workforce shortage here. So what we want is to return the QTT program to the 2023 levels and keep that pipeline open. Next, community support programs. This is a community-based wraparound program for people who live with serious mental illness, based on the evidence-based assertive community treatment, or ACT model, developed here in Wisconsin. CSP is administered by counties and covered by Medicaid, but right now counties have to pay the 40% of the non-federal Medicaid share. So the federal government pays 60 cents on the dollar. Somebody has to pay the 40% for each Medicaid dollar match grant or match money. And right now, the counties are on the hook to do that. What we want is the state to take over payment of that 40%. And we also would like to create incentives to benchmark to the ACT. This is a world famous program that developed here in Wisconsin, and we want it benchmarked to the evidence-based ACT fidelity score. And so financial incentives to help CSP programs come into fidelity to ACT. And then also to allow for inter-county sharing of hard to hire positions like psychiatrists and substance use specialists. And then also to just kind of lift up that the first episode psychosis, which is another evidence-based wraparound array, can be offered under the umbrella of CSP. And it'll help a lot of folks get early treatment, emerging adults. And then next, peer support services. Peer support is a service in which individuals in recovery from mental health and or substance use challenges connect with those who are currently facing similar challenges to offer support and connection. And in Wisconsin, peer support services can be reimbursed through comprehensive community services, which is kind of a brokered case management model. But the person has to first enroll in PCS, and there are waiting times, and then there are also burdensome documentation requirements for the peer support specialists. Excuse me. So our request is to create a billing code to allow Medicaid reimbursement of certified peer specialists directly. Next, the Access and Equity Work Group is recommending lifting support for community health workers who are public health workers who are trusted members of the communities they serve, and through outreach, community education, informal counseling, social support, and advocacy, CHWs facilitate access to services and improve quality and cultural responsiveness of service delivery for underserved, primarily, diverse populations. CHW services are currently grant funded for the most part, and our request is to create a direct Medicaid billing code and to enhance CHW mental health and substance use training. Next slide. Criminal Justice Work Group has two proposals. One is for an independent ombudsman to oversee Department of Corrections compliance with the Americans with Disabilities Act, and the second is expand the Treatment Alternatives and Diversion Program to add mental illness as a qualifying condition. So next slide. The independent ombudsman, I'm not going to read all of this, but we propose an independent ombudsman program to oversee the Department of Corrections compliance with the Americans with Disabilities Act and other statutes concerning inmate civil rights. And without accommodations, many inmates who have mental illness or mental health challenges don't have the capacity to file requests for psychological services or educational or vocational programming without those accommodations. So what we really need is somebody to oversee the help that people in the DOC prisons are getting in order to access these services. So our request is for an ombudsman in each of the DOC regions. And then the next one, TAD expansion, mental health and diversion programs and treatment courts address the intersection of mental health issues and the criminal justice system. They provide a framework for treatment, rehabilitation, and diversion, reducing recidivism and promoting public safety. These programs operate in several counties, but many regions remain underserved, and the current statute says that these programs must, the participants in these programs must have a diagnosed substance use disorder. What we want to do is to expand the eligibility to include mental illness with or without a substance use disorder. So I see Bruce's hand up. I think we could take the slides down for now. I think we have time for questions. So I'm just going to.
I just wanted to step back to the recommendations on the ombudsman. I think what you're really looking for is an ombudsman to the institutions.
Right.
And the regions are for community corrections.
Well, we can discuss the fine points, but what we had been asking for was because there are both community corrections and facilities in each region, and we think that we're going to have to start with only a couple of these people because the state's not going to want to go for lots. So we said, let's start with regions and decide how that works from there. Does that make sense, Bruce? I know you've got a lot of experience in DOC, so thank you. Other questions? I kind of raced through all of that, but it's not the first time that most of you have heard about this. So I am going to turn this over to Mary Kay to talk about our breakouts and what we're going to do in the breakouts.
Thank you, Sita. I appreciate that. I'm going to now cover a little bit about what we're going to do today. And it is now time for us to plan our course of action. We've spent almost 2 years gathering and talking about ways that we could have an impact and improve the mental health system. And I really appreciate everyone gathering, but today is the day that we're going to talk about how we can take some action. So we're going to divide you into breakout groups based on your Senate district with the intent for you to plan to approach legislators in your local community. This is the most impactful. As Kathy said earlier, we get much better communication with legislators when we meet them and talk to them, and also come as constituents with the information and also your lived experience stories, whether it's your lived experience, your loved ones, or someone that you care for, or in your organizational settings. Besides us gathering, which has been a great part of MHAP, this is probably the most important part of this partnership, is us showing up and advocating and asking for these sort of things. So I'm going to share quickly my slides, and be patient with me as I'm not always the best at technology. I think I did it. Okay, so each breakout group has been assigned by facilitators who will help the group focus on key legislators, whether senators or assembly representatives. For example, if you have a member that's a senator or an assembly member that's on the mental health committee or on the joint finance committee, we really want to target them because they're the ones we want to have the ear of, right? However, some of our proposals, for example, the DOC ones, there may be other committees that might be important on those, and we may want to target those senators that may be on those committees that would have an impact. So the purpose of these breakout groups that we are going to go into is to organize and plan activities to educate senators, and we have a lot of new representatives in our capital this year about these MHAP priorities. And that might include in-district meetings. It might include coordinating emails, coordinating phone calls, or showing up at events in your community. But before I go over what we're going to do today, I just want to emphasize one thing that will make us walking into the senators in district office or meeting them in a coffee shop that will make the biggest impact is we want all of you to sign on that if you're willing to sign on to say you have been an MHAP participant. The more that they see that all of us have gathered and collected and come up with these needs and these priorities, the more impactful our ask can be. So while you're walking in with 3 or 4 people, they can see all of the list of people that have been gathering for the last 2 years. So we want a list of participants, if you're willing, either individuals or your organization or both, to be sign on for that you've been a participant in MHAP. And then also to sign on to each of these priorities. So after this meeting today, and perhaps tomorrow, Julia will be sending out an email with a form, kind of a survey form that will allow you to go in and identify that, yes, I'm willing to have my name added to the MHAP list. And then the option to sign on to each priority. So you don't have to sign on to all of them. You can choose to sign on to some and not all, but we really feel it would be very important to have those signatures, because then when we walk in, and we will share the information after March 14th. So the deadline to sign on, because I know some of you will need to go talk to the other members of your organization to decide which priorities you would like to support and sign on to. We would like that to be done by March 14th. And then after March 14th, we will share the information with everyone so that you can walk in with that sheet with the signatures added to it, because it will have a greater impact to see the sign-ons of individuals or organizations for all the priorities, as well as who participates in MHAP. So that is going to be a big ask that we will please watch for an email from Julia. I'm going to repeat that a few times today. But back to today's events. In your breakout rooms, which will be based on your Senate district, we would like you to go in and pick one coordinator per legislator. So when you go in, we want somebody to be the coordinator for this group, so that help organize and educate and collect people and gather them so that they walk in and have a coordinated effort. If your legislator in your district is in the Joint Finance Committee or Senate or Assembly Mental Health Committee, we should, again, really focus on those members. That would give us the greatest impact. In these breakout groups, we want you to discuss the strategy, in district meetings, who your key legislators are, coordinate emails and phone calls, and also talk about if there's going to be possibly town hall meetings or joint finance committee meetings, because they do those all over the state. And that will be very important. We also want to say that it is best that you look at who's in the breakout room with you and say, who's not here? We want to reach out to them and we want them to join us. So it always helps to have representatives from the county, from the hospitals, from clinics, from the criminal justice personnel. Make sure you have families and peers and underserved communities. As you plan for your action after March, think about who's not here today in your breakout room and who do you want to reach out to say, hey, come join us. We want you to participate in this so we can advocate as a group, as a partnership, as a coalition, as we've been participating. The other thing is the sampling messaging. It's always helpful to just have that sampling messaging as, hey, I've been a participant in the Mental Health Action Partnership. We represent individuals and organizations involved in mental health care. Based on our collective input within this coalition, we recommend and name 1 or 2 main priorities and describe our talking points that we will share with you. And very important, and it's something that my organization spends a lot of time talking about, is give your personal perspective. You know, at this time, as Sita referenced, the Medicaid issue is it's very stressful right now to have that conversation, and they can tell you, oh, well, we don't know what's going to happen. But when they hear constituent stories from the field of what real life situations that this would be impactful for, that's going to be the most meaningful. So please bring your individual stories to share as well. We will have the materials as Cedar referenced, and I think Julia dropped in the box, the proposals, the collection of all of the proposals on, I think it's a 4-sheet paper. Once we have all the sign-ons, we will send out a copy of the individual issue papers. And then we will have an MHAP overview that also will have all the sign-ons that we will be sending out. You've received draft forms of that, but these are the materials we will provide to you. And we'd love for you to take those, use them in your emails, walk into meetings with your legislators to share those materials with them. Okay, now I'm going to talk about what we're going to do next. We might want to stretch for a minute. So let's talk about now. So as we have said several times, we're going to put you in a breakout room districts. We were very excited. We had people sign up that allowed us to have every district represented in the state. So some of them just have 1 or 2 people. So if you go in your breakout rooms, you may have other people from other districts in there, but you'll have at least 1 other person. I think, no, there was one that had singles. But we will break you out. If you have 1, there's a group that's going to be 1s, and y'all can discuss strategies on how to bring more people with you. If you have 2s, we have a group for that, and 3s. And then everyone else is going to be in their own district. So just letting you know, you may go into a room with more than 1 district just because that's the way it happened, that you only had 1 or 2 people sign up. Choose the legislators from your district to educate, and choose 1 coordinator to per legislator to lead this action. Choose 1 or 2 priorities that you want to focus on. Even though we have 10 priorities listed here, it's overwhelming for legislators for you to walk in with 10 priorities. I think we believe it's very important you walk in with 1 or 2 priorities that you want to focus on. Maybe there's one that's more meaningful in your community than the others, so that's up to you. You're going in as your own constituents, so please identify what priorities you want to talk about, and then identify the local partners that are in your room, who should be there, who do you want to connect with, and introduce them by email to the coordinator. At the end of the meeting, the facilitators are all going to let Julia know who each of the coordinators are, and that if somebody reaches out to us and says, hey, I'd like to advocate, she's going to forward that email to that coordinator so they can be participants in that group. So again, decide strategy in district meetings, email, phone call, whatever you're going to do. Coordinators, contact Julia. Organize activities and be ready to hit the ground running by March 14th, and implement after receiving final materials and sign-on letters. One thing, a couple of tips again is it's most effective if you if you choose less priorities, because all of them, we could have 20 pages of priorities we'd like to see change the mental health system, but really zeroing in on the 1 or 2 that are a priority. And if you don't get through all of these steps today, at least we are getting some forward motion, right? We're asking you now to be accountable. We picked the name, the core group of MHAP picked this name, and the word action was a part of it. And really, this is the most important part, is the action of taking this and advocating. And we really want this to be an action step today. So we're just asking that you be, take on this task and move it forward in your community where it would be most effective. I am now going to stop sharing and see if anybody has any questions. All right, so then I believe we are going to be in our breakout rooms for a while because we did really good.
Yeah. We'll be in until 10:35. Yeah.
Okay, so we will have the ability to be in the breakout rooms for an hour. Do we want to reduce that time period?
Could we check back in 45 minutes and see how everybody's doing?
Julia and Hannah, are we able to do that? Are we able to come back here at 10:15? Or do we want to do it at 10:30? Kathy's thumbs up. Yeah, so let's break out into the breakout rooms. Julia, is this going to mess up how you have it set up?
I don't think so. I think we can come back. It just might be tricky if we came back and then had to go back into breakout rooms.
Okay.
But I'd be surprised if we needed more than 45 minutes in breakout rooms.
Yes. So why don't we break out until 10:15, and then Julia will bring us all back. So the facilitators, you have a little less than 45 minutes.
How about if we say 10:20? Because I think 45 minutes is probably what we'll need.
Okay, I think 10:20 makes sense. That should be about
40 minutes. Yep.
Sorry, we were trying to time this and we were fast. So 10:20, we will come back. We'll do a summary, and you will now be taken to breakout rooms based on where you signed up when you registered. Yes, Jean.
So there is a question in the chat about having the slide. I'm assuming the proposals, will that be up in the meetings?
No, it won't.
Okay.
So
I can put the file in the. Sorry.
Yeah, go ahead, Julie. Yeah.
Sorry, my screen did something weird, so now it's.
I think everybody's joining their rooms.
Yeah.
I was going to put the slides in the chat, so then the file, so people can open up the file and see the slides if they want to.
Perfect. Thank you, Julia.
Yeah, no problem. Good question.
Kathy, are you back in the room yet? There you are.
I am back. I was looking and I was thinking, it must be me that it is me that is on now. I am going to ask any facilitators to speak. Anyone who has questions or brilliant ideas or useful resources that came up during your breakouts. Any of the facilitators want to kind of raise their hand and be first, or even just unmute and be first? And also just a reminder to please email notes to Julia for whatever notes you took out of your session. So questions, ideas, strategies, resources, information, it's all is game. Hello, Mark Herstand, please.
Hi, Kathy Markland. I had the privilege of doing the 29th Senate District with Aaron Ruff and Jaleesa Perez. And we did talk about workforce and also community mental health, community healthcare workers. And in terms of the workforce, what we're going to be looking to is getting information from the QTT program in terms of what counties, whether Marathon County has been funded in the past, and also if we can, if any agencies were not funded this year because of the huge drop in funding, because of the loss of funding, and that would be helpful in their work. And maybe some other rural areas would also, who are looking at workforce, the qualified treatment trainee staff, which is Ben Montpierre, who's at UW-Milwaukee. It's connected with DHS. They have information and maps on where the funding has gone in the past, i.e., where has qualified treatment trainee people been hired and worked in the past versus now. So that's one of the things that we're looking at, to getting that information for them, and then when they meet with their state representative and possibly state senator, they'll have that information. They can say, look, we have a shortage, and this program, we need this program to come here. And the only way that's going to happen to get more mental health professionals in our county is if we can expand this program.
Jeannie. Or is it Jean?
It's Jean.
It's Jean.
Thank you. So one of the things that we talked about one of the things that we identified as a priority is the clubhouse, the psychosocial clubhouse program. And I think it was a very important conversation, but because what we talked about was, yes, that is one of our priorities, but as we are building kind of the fact sheet about it for our presentation to the legislators, building in peer support services as well, to talk about how that workforce can play a vital role in the clubhouse models, as well as addressing workforce issues. So I think that was an important piece of the conversation, is that we can kill two birds with one stone in that area. And then we also talked about what type of information we can put together for the legislators to provide additional context to the three priorities that we have selected. So, drilling into the policy papers or the position papers on each one of those, of course, but I like, the idea of what Mark was saying too, about some additional localized information being researched as well.
Yeah, I totally agree with that. I mean, I think both of those are good examples of sort of taking and integrating in some additional components that are going to be really relevant to the group you have gathered, but also directly to that legislator. Cheryl.
I had the situation of having three different Senate groups in my group, which was fine, but that meant we were only able to actually get to the very bare bones of what we were supposed to do. But we've done that. But the question came up is, what is the thing with getting emails of others who may be in their Senate districts, and the emails of those who were in the group that they were in today? And secondly, some of the proposals, strategies are dependent on whether or not their organizations give approval for participation, because in this very sensitive political situation, some organizations may be a little bit reluctant about some of the in district meetings, for example, or in-person meetings. So that was my comment.
That's great. Thank you, Cheryl. Those are two great flags. Michelle.
I also had two different sort of groups of folks. So we focused on one, being that Senator LaTonya Johnson is on both the Joint Finance Committee and the Mental Health Committee. We decided that would be the obvious choice. And luckily, one of our illustrious members has already been doing quite a bit of work to reach out, not only, but to reach out at all levels of government. So Pete Christensen has been doing God's work down here in Milwaukee, getting together, meetings with his alderman, supervisor, again, thinking of how the local level also connects to the state level. So we did have two different sort of Senate or representative districts. Pete talked about if we can also, get different members, different representatives and senators in meetings together, that can potentially also, have compounding effects. I don't want to speak for Pete. He's more than able to talk about his work. Anything to add, Pete? No. Okay. No problem. Yeah, go ahead.
I was just going to say, anybody is welcome to reach out, and I'd be more than willing to share how I've done what I've done so far. Admire, it's not just me. I mean, it's us as a group. I just happen to be more, probably more active in trying to line up people. And I come from a sales background, so I'm used to hearing no.
Well, excellent. So I just wanted to, the only thing I just wanted to bring back to the main group was a few of us in the group have registered for MHAP participation with our work emails. But for these kinds of activities, it would need to be done through our personal emails, that we are doing this as private citizens, not associated with our organizations. So for my group, the folks that were willing gave their personal email addresses that I will provide to Pete as well, and to Julia as well. And I think that's all for me. Thanks.
That's a great flag, Michelle, and I am curious to have that discussed, perhaps revisited again before we wrap up today. Rick.
Well, small but mighty group with experience reaching out to legislators, particularly, well, in our case, Senator Felskowski and Assemblyperson Swearingen. The needs in the North are, well, they're bad all over, but they're so substantial that the suggestions were to combine, as actually did the governor a couple of years ago, community health workers and certified peer specialists, also to combine best practices, CSP and DBT, and then because of how really challenging the workforce shortages up here across the board of mental health providers, loan forgiveness, and QTTs. So that's a lot. But again, some members have been in contact, some of our group of three, actually all, have been in contact with various legislators. So we're going to meet in a couple of weeks after the governor's budget and formulate a plan, but also invite others that are locally interested, have powerful stories, so that when we engage directly with the legislators, it'll be a larger contingent.
Jump in, Mary Kay.
So Lisa just left, and I wanted her to stay on because I had a group of 3 different Senate. Well, I had more, but we had 3 groups, which was great. Great group. Really walked through a lot. But in Polk County, Lisa, who I think just left, unless she's still here, said that they went to the county board and asked their county board to write a resolution in favor of something, and that they were suggesting that if that is something like for CSP or for the PRTFs, if your community hospital really needs something like that, that might be something to get that power in the local community of wanting something like that. So I thought that was a great idea. She was going to share it with some other members there, and maybe we can get her to share the sample they had that you could take to your county board for a similar resolution. But the areas, I just FYI for everyone, the areas that seem to be bubbled to the top with the 3 different senators and 3 different coordinators and groups was CSP, the PRTFs, and the clubhouses seem to be popular, and the ombudsman. Anyway, so it was exciting to see people think about their own local community and what would benefit the community for their priorities. So that was great. So thanks.
Thanks, Mary Kay. Sita?
Yeah, so I had the group where everybody was a group of one. Everybody in my group is a coordinator. One of the points that came up, and we're focusing on treatment alternatives and diversion, PRTF, and the ombudsman program. Those were the three that kind of rose to the top for the people who were able to voice their priority. But one of the things that arose was in the ombudsman program, there are other ombudsman's programs. So, you kind of look adjacent necessarily to the program that you're advocating for. And so we could bring in a long-term care ombudsperson in a conversation with the legislator and say, this is what an ombudsperson does. Because it may be the legislator might go, okay, what are we talking about? And then the second one was with PRTFs, county human service directors have had to drive children to Nebraska and, Tennessee and wherever, and judges have had to drive out of state. So there may be some very well-placed stakeholders who have a stake in something like PRTFs.
Thanks, Sita. Sashi?
We also had a very small but mighty group in one Senate district. So Jeff Smith, so the Eau Claire, Chippewa Valley region. I think we decided to kind of focus on him, and then Clint Moses, as he's the health chair too. Unfortunately, none of our team members had like a connection with Clint, but now is a good time to make one. So because we had such a small group and it was only kind of representing only NAMI Eau Claire, kind of one of the next steps is to brainstorm other partners in the area and kind of bring a small group with a proposal of how to go forward. And then PRTFs came up for us as well. And then kind of like what others have said, it was really hard to choose one other thing. So one way where the group was kind of thinking about it is like, community-driven support. So both Clubhouse, peer support, and TAD came up as other kind of the areas they would want to talk about. So that's kind of where we're at. That's good.
Okay, and is there anybody else to report out besides my group? And I'll just share a couple of things, and then I kind of want to hit some highlight things that I'm gleaning from the elements before I turn it back over from a facilitation perspective. So our group had Melissa Ratcliffe in common as our senator. And so some familiarity already with working with her and her level of investment, particularly in access to mental health for minors. We know that there's already some commitment there. Also some representation from, both myself and WICSA sort of kind of the highlight kind of as organizational pieces. And so in terms of narrowing down priority issues, very much driven by, for us, by our organizational issues, and not really seeing a separation between that and what our organizations are driving to do, because we're really empowered. Everybody in our room was empowered to sort of speak on behalf of their organization. And so really thinking about it more from that lens in terms of the conversation that we had in our room was more about how do we best put materials together? How do we think about when you're really trying to get that connection with the legislator, the sort of the how of that, and talking about, the importance of doing that in district, if at all possible, ideally, perhaps at a site specific. If there's something, if you have Clubhouse, for example, have them into Clubhouse and really do that site visit piece and bringing other partners into that space. If you can do that collectively, as opposed to, as a more powerful messaging way to deliver a concrete experience of services. We also talked about the county resolutions, and so wanted to just flag those and just that as a tool, but then also to recognize that more than 40 county boards now have passed resolutions around crisis and CSP. And so to have awareness of that and to know whether if that's going to be on your list, to know whether your county board has passed one would be a good thing to check in on. So just a couple of items from our group there. Things that I flagged out as people were talking that I want to get back to, and oh, Julia, you still need to go? Sorry.
No worries. I can report really quick from my group. The things that rose to the top for us were CSP, Clubhouse, peer support, and the DOC Ombudsman proposal. And I just wanted to share a great idea that someone in our group had of that Senator Kelda Roys from our district does coffee with Kelda periodically. And so we talked about that as an opportunity to meet with her in a kind of more informal setting to talk about our priorities, which I thought was a great idea. And then we just talked about how to kind of be strategic with targeting Senator Roys because she's on the Joint Finance Committee, while also recognizing that it's really important to educate our representatives as well, and thinking through how we can do that with like an email campaign, for example. So that's it from my group. Thanks.
Well, and I didn't mean to skip over you, Julia. Thank you so much for sharing. All right. Anybody else have anything else they wanted to share from their group, even if you weren't sort of the facilitator, that they wanted to make sure was in the mix here before we kind of shift to closing? And I have just a couple of things that I flagged from the facilitator shares that I wanted to put back out to. Yes, Brad.
So I was thinking,
sorry,
you're good. Do we have a way of contacting the media? Because I've been in touch with someone who works at
Wisconsin Public Radio.
Wisconsin Public Radio, and they're actually doing stories about how the administration is currently can affect people who get Medicaid. So that might be something to think about, because I've been surprised at how many people I've been able to talk to. So.
Yeah, I love that question. And I will say at Core Group, we've not talked a lot about media strategy per se on behalf of MHAP. But I do think this is an excellent place for us to connect with people who would be great to bring into when we are having those outreaches and those with media folks.
I really think that reporter would be interested in getting information or even partaking in some way, because
we've been a little reluctant to invite media in because we want people to feel free to talk amongst themselves. That said, if you do talk with a reporter about one of the priority asks, you can say, and this is a priority of a statewide mental health coalition called the Mental Health Action Partnership, and you can link them to our issue papers. So while we want to kind of preserve this as a safe space, we do get our messages out there. That's a really good thing.
Yeah, and I want to acknowledge, Neil, I'll kick it over to you, but there's a lot of good resource suggestions coming up in chat, and I don't want y'all to miss those. So take a look at some of the stuff in chat. Jump in, Neil.
Oh, I just referring to the chat and my dear colleague Rick Imler, who I've been working with on some initiatives around DBT. I just really want to emphasize what he's pointing out there, that and we have been beating many doors and our heads against brick walls at times, trying to get things pushed through legislative means, and the value of needing and the importance of needing to reach across the aisle. And I talked about this a little bit in our breakout room, and just the reality that, I mean, in terms of legislative agendas, Republicans are sort of in control. And on one hand, we've had a lot of interactions with a lot of Democratic Assembly people, senators, et cetera, who often will be very much, yes, this sounds great. And you know, we've been told basically from some people in power that unless you've got, you know, a Republican that's at the top of that bill, you're going to have a hard time pushing something through. So on one hand, we've had conversations with a number of Democratic Assembly people, senators, et cetera, and they're very complimentary and they love what we're doing, but also don't have a whole lot of power to push things through. So I just want to sort of, I think that idea of, if we're going to talk to Democratic leaders, who do they play nice with? How do you reach across the aisle, and also just trying to find opportunities and means to reach out to some of the conservatives, if you will, and trying to get people behind us. And we've done that. And as Rick has pointed out, we're working on a meeting right now with our second meeting with Senator Filkowski on some things and a couple other senators. But that's going to be an essential, I think, piece to getting things pushed forward from a legislative standpoint.
Yeah, I think that's a great strategic point, Neil. And that's, that certainly gets into like the how do we actually achieve some of the objectives here, is that we need to have messaging that's going to resonate with across the aisle, as you said. And I think I love the suggestion from Rick that we ask those who are our supporters, how do we best reach others, right? I think that's just generally a good way to kind of use those folks that are in our corner to help us think through that reaching out. And I think some of it is, recognizing that this, I will say that these are conceptually, one of the things we talked about in our group is that, the question that comes up is, well, how much does it cost? What is the cost? What is the cost? And to remember that that the offsetting of the investment in some of these pieces as being truly preventative towards higher level costs. And so to know that to be able to speak to sort of that, that it's not just about additional expenditure, it's about spending the money better. So that we're actually enhancing the quality of life for people. I wanted to get back to the question, and I'm kind of throwing this out there, and I'm maybe not further along in my script to know this. The question about emails and how those are being shared. So I assume we're returning to that. And then Michelle's point about personal emails versus people's professional email addresses. And since we are doing home addresses, right, that was how we drove sort of the gathering of people. The question about, does your organization authorize you? I think it's an important one to ask, like, have you been empowered to speak on behalf of your organization? We're certainly going to want you to zone in on that as we start to sign on to some of these proposals and ask you to be a signer. We're going to have to know whether you've been authorized to speak on behalf, or whether you're speaking on behalf of yourself as an individual. And then the other thing that Rick flagged, which was his group regrouping after the governor's budget. I wanted to make sure we're touching on that as well, like recognizing the governor is going to put out his budget next week. So there are some things that will come into clarity, at least for us needing to be able to be conversant with, yes, this is in the governor's budget. No, it's not in the governor's budget. This is a separate ask. This is outside of that. We're asking for more than what the governor's put in, that sort of thing how are we resourcing people around that? How do we help people be cognizant of that as they move forward in their conversations? And I think those were the ones that I pulled out for notes for how we're wrapping today.
Can I add one thing as far as, bringing a bipartisan effort together? I would focus on the counties in Wisconsin and the districts that are the poorest and go to them, because that's where the crime, the mental health, all these things are going to be greatest. Those are the people that, as far as Republicans, there's plenty of counties out there Republicans represent that are suffering. It's not just Milwaukee, Racine, or any of the Democratic strongholds. Poverty doesn't discriminate. So I would highly suggest that you focus, as far as Republicans, go to those counties and districts that are the poorest and start trying to see if they'll buy in and bring their bigger group to the picture.
So I wanted to address just pragmatically. So each legislator, we hope, has a coordinator. somebody in the group who has agreed to be the person that is coordinating connection on behalf of MHAP with that legislator. And so that coordinator is agreeing to have their email shared. It may be their personal email rather than their organizational email. And so people in that group who are reaching out to other folks will have that coordinator's email, people who were here today. If there are people who from the broader community who hear about this through the grapevine, maybe they could connect with Julia and Julia can connect them with the coordinator. But that coordinator is responsible for whatever strategies you all use to connect with the legislators. So whether you're planning to have an in-district meeting at a coffee shop, whether you're planning to coordinate emails within a 2-week period and or phone calls within a 2-week period, or whether you want to get everybody to turn out to their town hall or their listening session, that coordinator is kind of the point person for that legislator. Is that clear? Julia, do you have any clarification on that about sending you emails?
Yeah, I think you covered it. So basically, the folks who agreed to be coordinators, I will be sending you the contact information for the people that were in your group today. And then you're going to take it from there. And, I am here to help with, provide support with coordinating. It's just that it wouldn't have been feasible for me to do it for everyone. So that's why we are asking for your help and for you all to, why we're asking you to volunteer to be the coordinator. So yeah, thanks.
Okay, so that's a perfect segue for next steps and materials and report backs. So each legislator in your work group has a coordinator to organize the strategies to communicate with that legislator. And if not, then reach out and ask another participant, if nobody did step up. But in my group, everybody basically nodded their head and said, we were in the group of onesies, so everybody in that group is a coordinator. And then please copy Julia to help us keep in the loop on who the coordinators are. If you're not reporting from today and somebody's chosen in the future, that coordinator, please email Julia at namiwisconsin.org. And then everyone connect with allies from your community. Think about county human service agencies, county board members, people who serve children and families, NAMI groups, parent school-based mental health groups. Just kind of think about who has a stake in the issue that you're advocating for, and connect allies from your community with that coordinator. And then the coordinator will connect with Julia to obtain a brief reporting form. It's not, but all we need to know is what you did and basically what happened. It's very quick. And we'll send the reporting form to the coordinators. The coordinators will gather the group virtually or in person to plan details of the activity. The coordinator should then contact Julia if they would like a printed packet of MHAP stuff. We can send you a nice, pretty, all green and white, black, printed up versions of the stuff that will be ready after March 14th. Then go ahead and implement the activities and let us know how it goes by sending the report back to Julia. So the best time for these activities, the planning is best done between now and March 14th. So you're ready to go when we have our materials together. The best time to implement is probably by the end of April, because the Joint Finance Committee will be out around the state. And by May, things start to coagulate, but at least by the end of May, so that we can report back what happened at the June 18th in-person summit that we'll be hosting. Use the supportive materials we've provided, and we'll keep you informed as bills come up on our legislative priorities. But we want to give as consistent a message as possible to legislators. That'll help us get it across the finish line. So the materials on the list, we have the description of MHAP. We have the MHAP proposals for legislative action. We have a sample email template, and then we kind of plugged in the PRTF just so you can see what a finished one looks like. We have a sample phone script, same deal. And then we have something that we use in NAMI called 7 Steps to Telling Your Story, which helps people boil down decades of experience into a 2-minute legislative story. So all of those materials are available to you. And if you, for your priority issue, go ahead and print out the MHAP issue papers, and you can give it to the legislator. At one point after March 14th, we will have the issue stated with who is supporting, what organizations and individuals are supporting that individual issue. So use those for your priority issues. And now I'm going to turn it over to Julia to talk about our upcoming events.
Okay, so in January, we had our learning session on the children's system redesign, which the recording is uploaded to, there's an MHAP playlist on the NAMI Wisconsin YouTube page. So the recordings for all the learning sessions and for the summits that are online, you can find them there. In March, on the 21st, we have a learning session coming up about hatch safety plans. And then in April and May, we'll have learning sessions, dates and topics TBD. So if you have recommendations on a topic for a learning session or a speaker for a learning session, please reach out to me and CETA. Our next MHAP summit is going to be on June 18th, and it's going to be in person. The location is to be determined. August 15th, another learning session, topic TBD. September, tentatively an MHAP summit in person on September 10th, potentially in Madison, but again, not locked down yet. And then learning sessions again in October and November, and then another virtual summit in December.
All right, so thank you, everyone. We really appreciate you all being here. We've done a lot of work in a short time. I know this is a lot to blog through, but now this is it. This is what we've all been gathering for the last few years, to take action, to get some things done, to have communications, and really the voice of all of us collectively gathering and doing that. So what we will have now is we will be sending you the sign-on letters soon, very soon, either today or tomorrow. We would like for you to invite all your allies to join your local MHAP activities and mark your calendar with the events that we just talked about in 2025. Julia is always keeping us up to date, and just a reminder of our CAP plans coming up. Again, that sign-on letters will be very important. We will try to, we've created it, but we will look at it again to make sure we capture non-organizational emails and items of that sort to make that clear for us. We want you to remember to complete the meeting evaluation that will come out. Julia is putting a link in the chat now, I believe, and we want to thank you all, folks, for joining us. Keep us in the loop of what's going on in your community. Reach out and ask questions, and thank you so much for taking action steps today. We really appreciate that. And you get 4 whole minutes back to your life, so enjoy that.
Bye, everyone. Thank you.
Thank you, everyone.